of
So they'll
altering.
look at your genes, they'll look at all of it and they'll go, that's either the addiction part, or that's the heroin part, or that's the depression part. And so just like you might do orthopedic surgery, they're just going to cut this one and cut this one, stick it together. They're going to give you like a cold virus or something like that, and it's going to go in and manipulate it somehow. Is that?
I think one day there's probably going to be a separate field of genetics, you may be called a geneticist or genetic surgeon, who knows, where you're going to be trained on really analyzing that person's genes. So a patient like you may come in to see me because you have some problem, and I'm going to now focus on where in your genetic makeup that problem could be located. And then potentially, if it's a severe problem that's failed all other conservative routes, consider genetic surgical treatment. Is that crazy?
Hello and welcome to another exclusive interview by Recovery Today Magazine at recoverytodaymagazine.com, where first and foremost, we're a magazine of hope. Whether you're considering addiction recovery for yourself, a loved one, or you're actively in recovery a little while or a long, long time, you're going to find all kinds of topics related to addiction, recovery, really living a happy, successful, sober life at Recovery Today. My name is Rob Hanley. I'm the editor-in-chief of Recovery Today. And we only, of course, interview really, really cool and interesting people. And today is absolutely no exception. He's been awarded as the top neurological surgeon for Los Angeles, California, as well as the top neurological surgeon for the Inland Empire, California. Based out of Los Angeles, he's been featured on NBC, CBS, MSN, Yahoo, and KTLA, discussing various things affecting our brains. I love this topic. Things such as love, fear, different addictions, of course, and various medical conditions, just to name a few. My guest today is Dr. Paul Kaloostian, or Dr. K. Thanks for jumping on.
Hey, Rob, thanks for having me. I love your show. Thank you so much.
Hey, thank you. You know, I was so grateful, as I had mentioned, that your assistant reaching out and kind of making some contact here.
Yeah.
As I looked you up, I was kind of joking around a little bit. I love to talk to super smart people, and particularly I'm fascinated by, brain surgeons. So it was really, really easy to say, sure, absolutely, we'd love to talk to him. And I have to say, what pops into my ADD mind, which I do want to know why ADD, but the thing I find so funny is I call it the Christmas party conversation. And the Christmas party conversation is when you get around to it and they say, well, what do you do? And you say, I'm a brain surgeon. So that's pretty cool, man. That's pretty cool.
Yeah, I've encountered that a few times, but I'm just a regular individual, obviously, and worked hard to get to where I'm at. But yeah, certainly people are quite fascinated by the brain and the spinal cord and our nerves, right? What makes us who we are, how we function, how we go about living our daily lives. A lot of that is really the structure of the brain and the spinal cord that work together.
Well, I am constantly fascinated by what makes us do what we do. And, even one of the things like, I'm always thinking of like Bible verses and things like that. And there's a scripture in there that's like, I do the things I should not do. And I don't do the things that I should do. We all know what we should do. And we all know what we shouldn't do, what's going to be good for us, what's not. And I'm always kind of thinking like, wouldn't it be great to just hit a setting in your brain that makes you automatically like want to go to the gym and automatically, eat right and automatically talk to people right, do all of the right kind of things automatically. And instead we seem to have these connections in our mind that self-sabotage. And I know we're, going from maybe the physiology of the brain to kind of the, consciousness, but you reset your all these things. So I'm fascinated by everything that goes on inside the noodle.
Yeah, no, and that's a big question there. And honestly, Rob, I personally don't think that we should all just do the same things or do, quote, the right things. Because I don't really think that there is a right way to do something. That's just my personal opinion from my experience in my life. I actually enjoy doing things that most people don't want to do, and
Yeah.
get a lot of joy out of that. Um, but certainly there are things that could be dangerous. Alcohol, smoking, drugs, which in excess, obviously, with the alcohol part could be a big problem. With drugs, could be a huge problem. Um, but I don't think there's really one set way that we should all live. I think we all live differently. We all find joy in different things that we do, but I think it's really just finding moderation in life. Everything in moderation, as they say. My parents and grandparents would always tell me that everything in moderation, right? Makes sense. How much can it hurt you if it's in moderation? Problems happen when anything is in excess of that amount, correct?
Yep. I agree. How did you decide that you wanted to get into neurology and brain surgery and things like that? How far back did that go? Just to tell us a little bit about yourself.
Honestly, I think when I was a fetus, but probably my parents are physicians. So, I kind of grew up at a house where sitting at the dinner table would be, a bunch of science and medical cases being discussed. And us kids, brother and sister and I, just listening to all of that, and just being pushed through school. That's really what we did: math, science, all of that. But certainly, I really did end up finding my own interest in it. Really, in high school, I took a course at Brown University during the summer, and the professor was just so enlightening to me. He actually wrote the textbook we used as well. And that was really my first introduction to how our neurons, which are the cells of the brain and spine, how those neurons function. And you could just think of a neuron as almost like a noodle, if you look at it under like an electron microscope, let's say.
Yeah.
But there's so much that occurs within that cellular structure that it would boggle your mind. I mean, there's years there's people's lives that are spent just learning about a fraction of what happens within that neuron. That's their life, So it's so fascinating to just learn about that, and then to learn about how that correlates within a clinical picture. So why someone becomes addicted, why someone gets a brain tumor and can't move the left arm for some reason, why they can't speak, why they're having seizures, why they're paralyzed, So all that was really quite interesting to me. And then as I just moved along in training, I saw, many, many cases. Yeah, I've done like 8,000, 9,000 surgeries, and
wow.
And it's
so just to put that in, I know that you work on spines, and I interrupt all the time too. I apologize.
Sure.
I apologize in advance just because I get excited.
I don't mind.
I know that you work on spines and things like that too, but when you say 8,000 or 9,000, I'm thinking of 8,000 or 9,000 skulls that you have open and you're looking at a guy's brain. Is that?
No.
No?
It's both the brain and the spine and the peripheral nerves. So like carpal tunnel cases and all of that. So it's all of those put together. But I can't tell you how many trauma cases I've done. I mean, gunshot wounds to the head. I don't know if I should say all these stories.
No. By the way, you're super smart, and you're highest echelon of society type of things. Normally, just so that we drop a lot of F-bombs. It gets a little ghetto, but not only ghetto, it's very raw, it's very real. You can just let it all go here in Recovery Today. So
well, that's good to know.
Yeah.
But certainly, gunshot wounds to the head, traumatic assault. Axe to the head. I can't tell you.
Axe to the head. Oh,
and it was still in the head when I saw the patient. It was just,
Was that an accident, by the way, or somebody axed that person?
No, that was purposely done.
Good Lord.
Did not survive. And that was like a year ago. Did not survive. But, and it was actually, unfortunately, the patient's son that did that to the father.
Yeah, that would be fatal, I would think.
Terrible. Yeah. Very bad. Very bad. We see so much, and I write this in my book, The Young Neurosurgeon: Lessons from My Patients, because I want you, the audience, I want people to know what we see. in medicine, especially from a neurosurgical perspective. And I mean, I write a story about a young kid, 30 years old, in New Mexico, in Albuquerque, a Native American kid out on the reservation. And I don't know if you know about Native American reservations, but it's in the middle of nowhere. I mean,
Sure.
there's
Yep.
there's just it's a beautiful land. I mean, it's gorgeous there, but just there's nothing else there. There's no hospitals, nothing. Okay. And so patients don't come in when, let's say, one arm is paralyzed. They come in when both arms are paralyzed, or when not when one eye is blind, when both eyes are blind from a tumor that's now growing all over. So when they come in, it's serious. So he came in with massive tumor that caused him to be paralyzed, and he was using a wheelchair for like 3 months. I'm like, why wouldn't you come in? Come on, it could have helped you here. It took the pressure off his spine. He actually improved a little bit in his legs, but these cases just take a toll on you. It's just so mind-boggling. I can't even describe some of these cases because they're just so unbelievable. And so I try and write a bit about them in my books.
Do you, I met a doctor that I chatted his ear off on the airplane one time. As I warned you, I do that. And, but I was really fascinated, as captive audience, guy sitting next to me. And I thought to myself, my only like surgery experience, in terms of seeing stuff was, I remember when I was in college, I smashed and cut still got a nice scar on my index finger. And I was doing construction work at some college, summer break.
Yeah.
And they sent me to get surgery. And it wasn't like a hospital, but I went to some clinic or something like that. And so they did all the saline and they cleaned it all out and whatnot. And, I was like 19 or 20. And so I was like, yeah, I want to see it, man. Like, they shot it up, and so
Yeah.
they're like, yeah, they're like, well, we'll lean you back so that you're not squeamish. Oh no, I want to see that. So they're like, okay. So I'm looking there and I got like a little hole, about the size of a pea or something like that on my index finger. And it's all, gross and whatnot. And I go, what's that? Is that my bone at the bottom? It was white, right? Is that my bone? She goes, no, that's your tendon. Like, move your finger up and down. So I remember moving my finger up and down and seeing this thing move back and forth. And all of a sudden the whole room was like, so how do you, I always wonder about somebody that is, used to things like you're doing something and we see on TV and it's like, oh, clamp, we got to get a clamp. And there's, blood squirting would freak everybody out. This guy I asked on this doctor on the airplane, he goes, never freaked me out ever, actually. So when you're working in a guy's brain and all these things, is it kind of like you're a guy like working on a watch and it's like, wow, this is cool. And it's obviously you don't get freaked out.
Yeah, no, I don't think so. Honestly, I think if anyone says they don't get nervous, they're total bullshitters. Okay. So everyone gets nervous. That's just part of being human. Whether you're fixing a brain or whatever, a watch or jewelry, etc. Everyone gets nervous because you want to do something well. And honestly, in surgery, of course, I always, before every case, in the middle of every case, I always get nervous. But being nervous is good. What is life without some nervousness? It gets you excited.
You give a shit, right? That means you give a shit. Yeah. Yeah.
It means you care. I'd be worried if you're not nervous, honestly. I'd be very worried. It makes you, I think, focus harder. Actually, I think it gives you the opportunity to do better work if you're a little nervous about it. And honestly, I don't really think about blood and this and that. I mean, I'm so focused on the case that you don't really have time to think about all the other stuff there. Yeah, there's blood, there's this, but you're focused on getting the job done, kind of like solving that puzzle, like you're putting a puzzle together. Yeah. And you're looking for that piece and you're not worried about anything else. You just want to find that piece and then go to the next step after you find that one. And then by the end of all of that, you're done. So that's how I do it. I think most people think like that.
How long do most surgeries last? And I know that there's different things again, but I don't know, on a guy's head, I guess I'll focus on the head.
Yeah, it just depends on what we're talking about. But certainly it could go from anywhere from, I would say, at the least probably hour and a half to at most, it could go it can go many, many, many hours,
What's
20
the
hours or
longest
so.
one? What's the longest surgery that you've done?
Well, I try not to do long surgeries. So I think uh, I choose wisely in terms of what I do and how I do it. So typically the longest one would be about 5 or 6 hours. And I'm pretty methodical, so I get through things pretty efficiently.
So that's kind of where I had a feeling it was going to be around 5 or 6 hours. And so, and I do want to get into a lot of addiction and stuff like that for people that are listening, but I am so fascinated by, you don't really get the chance to talk to a brain surgeon very often. So I'm going to ask you a lot of brain surgery questions and stuff, but
Sure.
along the lines of like what's possible and performance, I am really intrigued by the amount of focus and attention, and you can't screw up every millimeter. Is very, very important. How is it possible that you can maintain the kind of focus for such a long period of time? I find that extraordinary.
Yeah, it's a good question. I sometimes I think about that, and I think there is some genetic component to that, where you have the ability to really just stand up for a long time and hold your bladder in, and not go
But
to the
I
bathroom.
didn't even think about that. I'm thinking about the mental,
Yeah,
that's true though, but I'm thinking about like the mental attention.
yeah,
Probably the most strenuous thing I will do is I'll write and I'll get into the zone, but I can get up and I take a nap or whatever I'm going to do. And you start that process and you can't do it until it's done as perfectly as you can. It's amazing.
yeah. No, I do think there's some genetic component in doing that, but I also think that you could also be trained. So both nature and nurture kind of working together there. I think the training it's a long training process, or we call it an apprenticeship process, where you're just doing the same things over and over and over again for 7 years after medical school. So then, and you're not really being paid much at all during that time. So you're really just under the mentorship of your professors, and you're doing cases. So
How long? Actually, I was talking to my wife and my daughter last night. I said, "Yeah, I'm going to interview a brain surgeon tomorrow,"
yeah.
and they said, "Oh, wow." We had this discussion about how long you're actually in school. So, like from college, like I guess freshman year of college, all the way through to I'm a doctor and I'm cutting open somebody's brain. How long does that take?
So that's 11 years of training after college.
Wow.
11 years. Yeah,
After college.
after college. Yeah, so it's 4 years of medical school, and then it's 7 years of neurosurgical training. And I actually did an extra year of spinal tumors and spinal oncology and complex spinal surgery for another year at the Johns Hopkins Hospital in Baltimore. So I added another year on there. So it's a very long training process. I honestly don't think it needs to be that long. Anyway, we'll go into that another time maybe. But
I find here's one thing I will interject actually as the capitalist,
yeah,
kind of more traditionalist person, because I've had these conversations. I've got a 17-year-old daughter, and
oh,
there's a movement right now, strange enough, sad, I think, very, very sad and frightening, that I think it was at Harvard, they interviewed they did a survey of these kids. And I think 44% of them were in favor of socialism and like another 7% of communism. So isn't that amazing in Harvard? And so
yeah,
at Harvard. And so, as I've educated my daughter about different economic systems and things like that, and I know I'm going a little bit down the weeds, but I'll bring it back. So I'm explaining communism. I'm like, okay, everybody has a job that's important and it all contributes, but in communism,
yes,
the garbage man gets paid the same as the brain surgeon. And I'm just struck by like it's kind of a system. Who would, I mean, of course, you're interested in it and its dedication and all the things like that. But I'm also intrigued by, the amount of that you go through to be where you are, training and
yeah,
everything.
yeah. No, it's certainly a very arduous road. But just imagine a world that doesn't have, let's say, doctors in it. Imagine what would happen. I mean, where would people go? Would they feel comfortable? it's scary, but I could just imagine a world without others, without other jobs too. And that would be tough too. So, I mean, everyone's job is very, very critical and important and very useful. And it's all fantastic stuff. But certainly, yeah, certainly a world without physicians, I think would be very tough and complicated. And yes, yeah, communism, socialism, all those different types of governments. I think it's interesting. We could have another talk about that. We could talk
I'd
for
like
days,
it.
about that topic.
Maybe we will. We'll stay kind of back on track for this conversation here. But one thing I have to ask is, right now Elon Musk is talking a lot about hooking stuff into our brain and things like that. And I wanted to get your thoughts on what's coming down the pike for new things that is maybe the evolution of technology into our body. My brother-in-law, who's I think he's in his 80s.
Yeah.
He had Parkinson's and he was shaking and the whole bit, and it was starting to get really bad. And they put some kind of wires, you probably know, right down into his brain. And I swear it's like he's been reborn. His personality, his energy, he barely shakes. He tells me that they tune it in with Bluetooth or, radio frequency. So there's some cool things that are happening right now. What's some of the neat things coming down the road, do you think?
Sure. And yeah, Elon Musk is doing a yeoman's job. I really respect him. I think he's very creative. Would love to meet him one day. If you're listening, I'd love to meet you, Elon.
Right.
But yeah, I mean, Parkinson's research, we've been doing that for many, many years. And, back in my residency days, my training days, I would do these procedures where we drill just a couple of holes on the head of patients and put these electrodes into the basal ganglia of the brain, which is kind of the center portion of the brain. And that's the area of the brain that controls your spontaneous movements that cause these tremors, let's say, and that afflict patients with Parkinson's disease and other movement disorders. There are numerous movement disorders other than Parkinson's. So by putting these electrodes in and finding the exact target using guidance, we had great outcomes in helping patients with a wide variety of disorders. Now, there are studies out there where patients are using it for obsessive compulsive disorder. And get this, major depressive disorder. Imagine how many people have major depression. So many, right?
That's where I was going.
Yeah, imagine having a treatment for that. I think that would be super helpful. I think, us humans, if we put our minds to things, we could certainly accomplish, I think, anything, anything. And it's just a matter of time and funds, really, and patience to get those things completed and sorted out. But certainly, yeah, depression, OCD, and other sorts of disorders are now really being targeted for treatment with these electrodes that are put into the brain.
I find that's really, you actually beat me to where I was going to go to, because I was going to ask, do you see a quote unquote, a physiological or a surgical cure for something like addiction? And I understand. I've got a friend that is also a neurosurgeon, and he was explaining to me a little bit about kind of why we're addicted. And I can't remember what it was. As I recall, that's some piece of your brain up in the top, and it's supposed to keep you alive or something like that. And it likes dopamine a lot, and then it basically just takes control of everything else. So you're kind of out of your mind. You're not really making the right decisions. Is there a way to turn that off or to turn it down or something like that you think is on the frontier?
The answer is that's going to happen. And I think you're talking about the nucleus accumbens of the brain. It's a region that's super sensitive and loves dopamine.
Yes.
So dopamine is a very important hormone in our body, as are all the hormones. But dopamine is super important in addiction research and in patients who are addicted to a variety of things: drugs, alcohol, gambling, whatever other vices. So dopamine is very powerful. And the problem with drug addiction that research has shown is there's a genetic change that occurs. So the problem is you get, there's a protein, FOS, FOS, that's been found to become altered in your genetic makeup. And so and that's with chronic addiction over time. And when that happens, it's hard to really change because it's part of your genes, unless now we go into the whole genetic manipulation, which is going to happen too over, in the future. And once you find that and clip it out, kind of like a vasectomy, clip it out, and take that out and just tie everything back. It's like it wasn't ever there. Until then, it's going to be hard to really cure that once it becomes a chronic addictive process. You can control it, but it's hard to cure it until we think about genetic ways of
so they'll look at your genes, they'll look at all of it, and they'll go, that's either the addiction part, or that's the heroin part, or that's the depression part. And so just like you might do orthopedic surgery, they're just going to cut this one and cut this one, stick it together. They're going to give you like a cold virus or something like that, and it's going to go in and manipulate it somehow. Is that?
I think one day there's probably going to be a separate field of genetics, you may be called a geneticist or genetic surgeon, who knows, where you're going to be trained on really analyzing that person's genes. So a patient like you may come in to see me because you have some problem, and I'm going to now focus on where in your genetic makeup that problem could be located. And then potentially, if it's a severe problem that's failed all other conservative routes, consider genetic surgical treatment. Is that crazy?
That is really, 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 it's kind of scary also at the same time.
Yeah.
It's crazy, but it's also, and I think that there actually is a good place for pause and thinking of like, we can do this, but then part of it is the ethical side. Like, should we do that?
Right.
Do we only want kids with blue eyes, or only tall people, or only, because there's probably a lot that we can do.
Yeah, honestly, it's happening now. People are doing in vitro fertilization, and actually the kids, are super healthy. The kids are like healthier than any other child ever, because you're looking at the best embryos, the embryos without mutations in them.
I didn't know that.
Yeah, and you're planting them in women, and they're having like brilliant children and healthy. They're not perfect,
Right.
but they're screened. I mean, they're screened for everything possible, and so it's happening. So now the ethical issues, yeah. I mean, I took an ethics course in college. I love ethics, and ethics is critical in medicine. We could talk. That's another talk about what are the ethical issues of medicine. There's so many things we could talk about.
So, and I'm happy to, by the way, because I can talk about any of this kind of stuff. One question that I have is, how about artificial intelligence? I mean, I've got kind of a two-part question. Is like, how fast does our brain work? And then artificial intelligence, is it really going to, I know that it can do, many more cycles and computations, but then there's the whole creative side of things too. And what are your thoughts on, the whole AI takeover of, and all that kind of stuff?
Yeah. Well, I mean, I think that, like I said, anything in moderation is going to be okay.
Yeah.
The problem is when you use AI and artificial intelligence for everything. So to the point where, let's say for these cars that are going to be driven without people in the driving seats. I mean, yeah, I mean, you heard about all these. All these cars are crashing because of a flicker of light, let's say, on the ground, and the car's interpreting that as something bad, and so it's killing people by pulling over. So all of these things could be potentially dangerous unless it's just kept in moderation, kept to very specific, cases. But I think that it could potentially provide some good. The goal is to provide good for people, right? That's the goal, is to help, right? Help the world somehow.
I am much more of a conspiratorial person. I mean, you're a good person.
Yeah.
And I think that doctors go into medicine because they want to help people. I think that they do things like you do. It's because it's like playing in the NFL or it's a super performer type of a thing.
Yeah.
But I'm more conspiratorial, like I'm thinking, no, big pharma, it's to make money, it's
Yeah.
to give people insulin for the rest of their lives instead of
Yeah.
curing diabetes and things like that.
I
So
think about that too. No, I think that's fair to also think about that side of things. And I think you're not wrong to think that way. I think that is a valid way of thinking. We just have to keep our eyes and ears open and just be cognizant. We have to be able to think on our own and analyze medications given to us. Should we take this? Just because someone tells you to take it doesn't mean you should take it. Just because I'm telling you take something. I mean, you could trust me, but I should be able to explain it to you so that you can understand all the studies done on that particular, let's say, drug or surgical procedure.
I very much am a believer that everybody's health is their own personal responsibility.
Yeah.
And I don't like, this might sound kind of strange to a doctor, but I don't like my doctor told me to do it.
Yeah.
I very much am about researching things myself.
Good.
And then I'll read things on the internet. And it's like, well, I'll listen to my doctor. And I'm thinking, well, I'm smart enough to listen to another doctor. I don't have to be a doctor to be able to listen to because there's differing opinions on lots of things. So I
No,
think it's all our own responsibility.
100%. I think all of us patients need to analyze what we're told. And you can get multiple opinions. I always welcome my patients to get numerous opinions. I think that's a great thing. Go out there and go and find, what other people can think about and get their information and advice and think about it, analyze things. Don't just become like a cattle. Think about the information, and sometimes you could take a zigzag line as opposed to just going in one straight line following everyone else. You can go in different patterns in different ways. That comes back to our point. Everyone lives differently, and that's okay. That's great. Differences are fantastic. It makes us better people if we all just learn about our differences and think differently and just share our thoughts and ideas. That's brilliant. It's great to hear that.
And it makes the world an interesting place too.
It does.
One of the things I'm very fascinated about, and I just had an interview with somebody that's really into personal development and our brains and things like that. We were talking exactly about neurons growing together and creating furrows in the brain of habits, like you're walking across grass and then eventually it gets trampled down. But
Yeah.
one question I wanted to know about is I wonder very often about what is our consciousness, and is there a place in our brain for our consciousness? There's even people that think that our brain kind of is almost like an antenna, and it's pulling in information from the ethos and things of that nature. Where is our consciousness located?
Well, typically the consciousness, as we think of it in the very general term, is really our brain stem. And the way you know that as a neurosurgeon is that if there's pressure, let's say from a bleed or a tumor that's putting pressure on the brain stem, you fall asleep. And so patients do that. They fall asleep. I had a patient just, I think 2 days ago, I was on call and patient was falling asleep on me, came straight from the ER because he was hallucinating. Family found him and we got a CAT scan of his head and he had big ventricles or big spaces of the brain where there's a lot of pressure in there. So the pressure in the brain is just building up and putting pressure all over to the point where he fell asleep. So I had to come in the middle of the night, it was like 1 or 2 a.m. and drill a hole in his head and stick a tube in. So I stick that tube in and that pressure just shot right out, like as if like a toilet was obstructed, just shot right out. And
gross. First of all, that's gross.
Second of all,
right. So it fixed him though?
He's awake. He's
Wow.
awake. He's going to need a permanent tube put in. So we're going to put that in from his head.
So he'll have this grossness, like he'll get something will happen and he'll some kind of what does that mean? He's gonna have a tube in his head.
You stick literally a tube underneath the scalp, behind under the skin, down the neck, down the chest, into the belly. It's all underneath the skin. You wouldn't see it.
Amazing.
And you tunnel it into the stomach, and that spinal fluid gets absorbed into the stomach. So as it's made, it gets absorbed into our stomach, and that's how
That's
patients
so,
live.
who thinks of these things? That's so freaking amazing, man. You know,
They used to put that, well, back in the old days, they used to put that tube in the gallbladder and the lung and the heart. I mean,
God,
you know,
it really is amazing. So I have to ask this because you did bring it up. I was like, I want to know that question too, is why do we have to sleep? Is that something that is in our brain? And do you think we'll ever have a pill that will enable us to just, I don't understand. Sometimes like I'll feel tired, but my brain is still going.
yeah.
But what is it? Is sleep in our brain, or is it in our body, or where is that?
Yeah, there's certain areas of the brain that control circadian rhythm, which is a fancy term for our sleep pattern. So that's what we call it, circadian rhythm. So let's say you go on a jet ride somewhere to Australia, let's say, and you come back and you're just like you're out of it, right? You don't know where you're at. You don't know if you should sleep or go running or whatever. Well, that's jet lag. And so when you get jet lag, that's like the disruption of the circadian rhythm, which is your natural hormones that are secreted, during the day and during the nighttime. So your body knows where it should be, right? Amazing how we're made, but that's the
Totally.
body knows where it should be. And if you disrupt that, you'll definitely know that because you will get jet lag. I've experienced it. I'm sure you have, and
Yeah.
others. It's a natural thing. Melatonin is a medication that people can take. And it actually helps to bring that circadian rhythm back because that is really the hormone that is involved in the circadian rhythm that gets disrupted. So that by taking that, it's FDA approved and people take it
And
all
is
the time.
that the new drug that I see on TV sometimes for blind people? There's a thing that they don't know since they can't see light, it throws off their timing or whatnot like that. Is that the same kind of thing?
I
Maybe.
don't know about that. I don't know
Okay.
about that one. Yeah, that's a good point.
I'll table that. I'll table that one. Well, a couple of the other ones I want to know is they're probably related, I assume, but what is happening when we fall in love
Mm.
or when we're afraid? I think of things about like, and I think there's a difference between love and being in love. Literally think that when you're in love, you're secreting so much stuff. You just do all of these you do anything type of thing. But what's going on like in the brain and love and fear and some of the things I introduced you, with what happens?
Oy vey, love. Right? Love can be the greatest time or it can be difficult for, there's ups and downs there, right? It's just a big hormonal mush of or smorgasbord of things, right? That's
Yeah.
what really love comes down to, and you do have different phases of love, and I talked about this a while back on I think KTLA, where you have that initial lust phase, and then you have like more of an attraction phase, and then you have like a comfortability phase. Those are if you look at love, that's what love comes down to. Okay, and all of them have good points to them, but there's different hormones that are secreted in each of these phases.
I didn't
With
know that.
lust.
I thought that from the lust phase, or I got to have some of that to, you have it. And then I thought literally kind of, obviously the joke is in the end, I just figured it kind of wore off, like,
Yeah.
type of a thing.
Yeah, there's arrows that go in both directions. So you could be in an attraction phase, but still sometimes have lust, and back and forth. So, um, but essentially, so yeah, with lust, you could have a lot of testosterone, obviously, and norepinephrine, this is the hormone that makes your heart beat like crazy. You're like breathing fast. You could do anything. You could run 100 miles, and how that is, and
Yeah.
and then you go to the attraction phase, where it's more kind of calming hormones, but yet still hormones that make you have that energy. So you have dopamine, you have serotonin, all these other hormones that just kind of make you feel comfortable, but yet still really attracted and energized. And then that stability phase where you have more oxytocin and these other types of hormones that are just kind of calming. You feel comfortable, you're happy, you're content, and by the way, love is also an addiction too, in a sense. I call it a pseudo addiction because it's not like a typical drug addiction, but it's a pseudo addiction. How do you know that? Well, let's say you fall out of love. What happens?
Got to get right back
Boom,
in.
right?
Yeah.
Boom. That's the low. It's a very tough time. I mean, we've all experienced it. it's a tough moment,
Yeah.
and people go through divorces and things, and it's a tough low, and but you fight back up slowly, but that's classic for an addiction. You're on heroin, cocaine, alcohol. Well, if you don't take it for a while, what happens? Well, you get that terrible withdrawal, terrible, and you can't really control it. It's all hormonal.
Yeah.
So that's how you know something becomes an addictive process. Where if you don't have it, what happens to you?
What are your thoughts on one of our regular contributors? His name's David Essel, and he's a really cool guy, and he's kind of a natural type of stuff. He's not a doctor, but he's really big into amino acids. And he
Yeah.
talks a lot about amino acids for depression. I don't know if it's 5-HTTP or I'm trying to think what he told me to get on. But what are your thoughts on amino acids in terms of enhancing stuff that's going on up here, making us feel better, et cetera?
Yeah, yeah, you'll find people give talks on that. My father-in-law was actually listening to someone on the radio talking about that. He's like, "Paul, come here, come here." And I've studied about all this.
Is he a
but
doctor too? Your
no,
father-in-law? So okay.
no,
Say your
no.
mom and dad. If your father-in-law, forget it.
Yeah, yeah, and you know, uh, so amino acids are the building blocks of protein. It's kind of like you need amino acids to build protein. So without amino acids, you could certainly have a variety of conditions because we're basically a bunch of protein. I mean, when you think about it, and and you need protein to make sure your DNA is healthy, to make sure your cells are healthy, your body, etc. And in terms of long-term studies that are randomized, I don't know of any big long-term studies that have shown benefit as of yet. So I don't think it's something that's like every doctor gives to their patients yet. But certainly, I think there's some smart people doing some good work on that. I don't think like I said, in moderate amounts, I don't think that would hurt you. But definitely consult with your doctor to make sure you're not on some other meds that may interfere with the amino acids you're taking.
Yeah, that can be bad. That can be bad.
Yeah.
So I've asked you all of these questions. Oh, I know there's one that I need to ask first before my next question is what about the Chinese kind of medicine idea that our brain is in our stomach or that we literally have like brain cell type stuff like in our gut? Or even actually that brings me to another one, which is the biosome, right? Isn't that what it is? The gut flora type of thing?
Yeah. I don't know so much about the Chinese medicine in terms of the I guess thoughts being in
Like
the
brain
belly.
cells in our stomach type of thing. Is there brain cells like in our stomach?
So what happens when you fart? You just
I don't know. Blow a brain cell, I guess,
I know I'm definitely a believer in acupuncture, honestly, Rob.
Okay.
So I love it. I refer patients for acupuncture. I think it's amazing. I've never had it done on me, but I'm happy to have it done on me. But it's worked very well. A lot of patients do really well. My wife has had it done.
I had it. Yeah, I had acupuncture yesterday for a shoulder thing. It's been helping. So yeah, I like it.
Yeah. So I mean, and Chinese medicine has been around longer than Western medicine.
Okay, so
And
let me switch out of that one then. How about the biosome? Do you know about like the biosome and the gut? And then the whole idea is that these little microbes actually tell our brain what to do and things like that. Fascinating.
Well, certainly, if you eat something and your stomach doesn't feel good, it's going to tell you that, right? So then you learn. So in that sense, yes. So if you have lactose intolerance or whatever, you're going to know not to eat it. Or if you're allergic to something, your body's going to tell you pretty quickly that I don't like you. But other than that, I don't know much else about that.
Okay. That's a really interesting one. What the whole idea is there are these microbes that release whatever it is that they release, and it influences our brain to do all kinds of wacky kind of stuff. I guess as I look to bring it in a little bit for a landing is I've asked all of these different questions, is all these ones I can get out about, what we know. But one thing I'm curious about is, the old adage that the more you learn, the more you realize that you don't know. And I'm wondering, like, from your view of all of the things that you know about what goes on in our brain and all of these things, what do we not know?
There's a lot we don't know. Honestly, when you think about it, we've only really touched the surface of the brain. We only know about maybe 5 to 10% of how our brain functions. Just imagine, if we only know about 5 to 10% of our brain function, and we know a lot, that's a lot. There's textbooks and et cetera on the brain and spinal cord, but that's only, let's say, 5 to 10%. Imagine getting another 10% of knowledge. What would that show us? How about another 20% after that? What would we be able to do, based on knowing that extra amount of information about how different neurons connect? Wow, it's super exciting to just
Completely.
think about that opportunity.
Is it true that we only use like 10% of our brains? They used to say 20, 30 years ago. I heard that we only use 10% of our brains. Is that so?
Some of us more so than others, but yeah.
Or some less more so perhaps than others as well. Oh, that is awesome. All right, last question is actually more like a spine kind of question is, when do you think that we'll see spinal injuries and we'll see some kind of genetic, or is it kind of going back to our genetic question, where we'll see some kind of regrowth of because there's a million different things that have to connect perfectly. When do you see that happening? 5 years, 10 years, 3,
I see that probably happening in 10 years. I know because of our rigorous FDA in the United States, we can't really do a lot of these studies, but in China and other countries that really don't have an FDA, they're pretty strong in doing all these studies on stem cells. They're injecting people's own blood that they take from their arm. They spin it in a centrifuge. They collect the platelet-rich plasma portion of it, which is like the middle or the smallest portion, which is rich in platelets, which is a specific molecule in our blood. And then they inject that into the spinal cord in surgery. And they found that people that are paralyzed have movement again in the lower extremities over time. I had a good friend who's a ear, nose, and throat doctor, but in Beverly Hills, and we were talking about that over at dinner one night, and he's actually injecting those stem cells into patients' knees and shoulders and other parts of the body, and he's finding good results with that. Those are all cash payer patients. Obviously, it's not really FDA approved, but he's finding very good outcomes with no side effects. So this is something that I think as time goes on is super important. I can't wait to find a cure for paralysis or spinal cord injury. That would be such a marvelous day.
I think that there is the frontier for this kind of stuff it's so beyond in terms of what's possible. Seeing my brother-in-law just be after years, battling with Parkinson's and he's just it's like a second life. It really is.
Yeah.
And it's a tribute to people like you. It would have been a neurosurgeon, I'm certain,
Yeah.
that did his surgery. Well, terrific. Well, how can people find out more about you? Get your poetry. I don't know if we even talked about your poetry. What was your novel about? You wrote a novel.
A bunch of cases in my training. It's called The Young Neurosurgeon: Lessons from My Patients.
Okay.
I think they're just super fascinating stories that really touched me. They're all true stories. Even my poems are all true stories, without mentioning patient names, of course. And they detail the struggles patients go through, but also what we doctors learn, what I learned from my patients. And you can find all that at drpaulwriting.com. That's drpaulwriting.com.
drpaulwriting.com. Really, really fascinating stuff. And, I have a million more questions. I want to do the best I can to kind of keep it into depression and anxiety. But in my mind, I'm always thinking like, well, this is outside of the physiology of the brain. And I just love talking I think the whole idea of brain surgery is freaking be amazing,
Yeah, happy to come back. We can talk more.
I would love to do that. I appreciate your time today. It's great to get to know you. And we'd love to have you back and talk some brain surgery stuff on any neurology or spinal cord, anything at all. That would be really, really cool.
Pleasure's all mine.
Well, thanks so much, Dr. K, for jumping on. This has been another fun interview, almost self-indulgent when I get to ask all these questions, but I appreciate it. And hopefully it was entertaining for some people who learned a couple of things as well. It's been another interview by Recovery Today Magazine. If you hang on just a second, that is a wrap.